When I turned 18, it was basically like, okay, go find a new adult oncologist. And I was like, I have no idea, like, I don't know how to do that.
Aging out of a children's hospital. What happens next for cancer survivors still facing side effects? Good morning. It's Thursday, March 2nd. I'm Jessica Lovell, and welcome to the Morning Medical Update. Cancer treatment can ravage the body, and for a kid, surviving it can mean long-term side effects. Today, we meet a team providing the long-term care patients deserve, and we hear why it matters to one survivor who needed a hip replacement while she was still in high school. Let's get to our morning rounds today, though. First, Dr. Ashley Simmons is the medical director of the Adelaide C. Ward Women's Heart Health Center here at the health system, and she is next to her daughter, Lily. Ladies, good morning to you.
Good morning.
Hey, good to see you both. Well, we are really looking ahead to a special event tomorrow night celebrating Just Like You Films. It's a local nonprofit creating documentaries and movies promoting inclusion and awareness for various health conditions that affect children. And we are seeing some of those film trailers right here on your screen. Dr. Simmons, you're a doctor here at the health system, also an honorary chair with Just Like You Films. Tell us about your involvement.
Oh gosh, well, first of all, the person who started the nonprofit is one of my good friends, Jen Greenstreet, and I served on the board of Just Like You Films from 2010 through 13, and my daughter's on the junior advisory board this year. And I mean, I think in serving in that role and seeing what Jen has done has been really inspirational. She's, won Mid-American Emmy Awards. She's had her films translated into multiple languages. It's shown in over 320 countries. But I think it really started with altruism, and I think that's amazing. Tomorrow night, the event is named after a woman named Nikki, who is a child life specialist at Children's Mercy. And Jen was trying to figure out, how in the world do I help kids? What can I do to help Children's Mercy? And she said, these kids are being isolated going back to school. This kid suffered a severe burn, and these kids ostracized him. She said, what I really need is something for the teachers to show that he's just like them, and trying to make kids more accepting of others. And that spawned a series of other films, including films on cancer and Down syndrome and facial anomalies and food allergies, or anything that kids could potentially be bullied on or isolated. So that's a long answer to your question.
No, lots of good information. Lily, you're a young lady. How important and how impactful can an event like this be, putting that spotlight on inclusion and health and kids? What kind of impact do you think this could make?
I just think it just brings so much awareness to like these people that are going through stuff like this at school. Like the big new film is food allergies, which isn't something that you really think is a huge medical problem until you really see through someone's eyes and like wear their shoes and see their story. So I just think it is so amazing because it brings all these people together to not only support this organization, but also like see the films and really understand what these kids are going through. So truly about educating people about ailments that may not affect them or their family, but they're affecting other people that your kids are around. So I want to hear about this event tomorrow night, because if you're not at it, you can watch it. Tell people where they can find this.
Oh, well, the event's actually at the Midland Theater downtown, and I think she's done a pretty good job. As far as how to link onto it, I might have to defer back to the website for that. Honestly,
Actually, Dr. Simmons, you can, I guess, watch the event at Just Like You Films Facebook page.
Okay, great.
You could find it there. Okay, good. So, okay, I did a quick reference on that. So good. So people can go there and watch it, and they'll be able to see some of these, some more bits of these films, correct? And learn more about the films and where to find them. Is that correct?
That's right. And you can always go, I mean, if you know a child that needs something like this, or a teacher or law enforcement or, anyone, therapists can use these films and access them online.
Fantastic. We're going to put a QR code. It's right there on your screen. For folks who want to learn more, tomorrow's event is a fundraiser. Dr. Simmons, where will the money be going to? How will it be used?
Well, that's the other thing I really love about this is it's small, it's women run. You know where the money goes, and it goes to producing more films for more kids. It goes straight to the product. It's not wasted on a lot of administration or anything like that. It goes straight to where it's needed.
Love what you're doing. I appreciate you both. Thank you so much for sharing, and have a great time tomorrow night.
Okay, thank you.
Thanks, ladies. Well, unless you or someone you know has survived childhood cancer, you might not ever consider, where do young survivors go when they can't see their pediatrician anymore? Christina Medina introduces us to a woman who had to answer that question for herself.
Laura Reed was a child when doctors diagnosed her with cancer. Now, as a mom, she sees the moment she aged out of a children's hospital through a different lens and is even more grateful for the medical team who anticipated that moment in her health care.
Okay, what are we gonna build?
I just want to grab a bunch.
I'm just amazed how much he's learning and growing. It's just really cool to see the world through your kids' eyes.
I'm making a dragon.
I love experiencing new things with them.
I'm not very good at Legos.
Yeah, you are. You built me a whole house.
Laura Reed cherishes the time she spends with family.
My family thinks that I'm like probably toxically positive, but I try and look on the positive side of things, because if you don't, the world can just crumble beneath you.
Laura was 14 when she was diagnosed with Hodgkin's lymphoma.
It was 8th grade 2001, and it was spring picture day, and that actually documented for me the day that I found the lump.
She was with her sister when she noticed a lump on her neck.
After a lot of tests and scans and a biopsy, I was diagnosed with Hodgkin's lymphoma at a stage 2B. So it was in my neck and chest. And the reason they wanted me to go to Children's Mercy so urgently was because it was pushing my windpipe over, the tumor. So they were afraid that I could stop breathing at any point.
She went through 6 months of chemotherapy and 1 month of radiation.
I think it's kind of like they're hesitant to say you're in the clear. They say you're in remission for 5 years, and then after that 5th year, they say you are cancer free. So once we got to that 5 year, we could party.
But Laura would still need a cancer specialist to make sure she remained cancer-free. She needed an adult cancer team, and that challenge gave her pause.
Going from Children's Mercy, where you have the best of the best staff and somebody who's watched you go through this traumatic thing and knows all of your health history, all of the ups and downs, and then you go to an adult who's just like, all right, here we go. Let's go do blood work. It's just a totally different feel.
Through research, she found the Pediatric Cancer Survivors Transition Clinic.
And I remember when I left that appointment, I got in my car and I cried, and I was just like, this is exactly what I needed. This is exactly where I'm supposed to be. It was the best doctor's appointment I've ever had. She sat there and listened to every single thing that's happened to me going through treatment. They really make you feel like you are not a number, you are not just a random patient. They know my kids' names.
Laura no longer felt lost. She found her place.
When you've had cancer, you're just at risk for so many other side effects and long-term effects. And so I just feel like I needed to stay on top of every single thing. They laid everything out and said, at 5 years, you will go do this, this, and this. You'll get, an EKG, and you'll have a mammogram, and in 6 months, then you'll have a breast MRI. And so everything just is mapped out for you. And that is so helpful, so that I don't feel overwhelmed.
With a health partner, Laura feels free to focus on her family.
I really think that going through something traumatic and hard, especially as a child, just shifts the narrative in your head. They're just the best things. The best things in my life is my little family here. Do you like the camera?
Are you just a model?
Yeah.
Are you so cute?
Yeah.
Laura is also excited to help other adults who have survived childhood cancers. She's the keynote speaker for a childhood cancer survivor conference hosted by Children's Mercy Hospital and the University of Kansas Health System in April.
And we are so pleased to have Laura Reed joining us this morning. Good morning, and such a beautiful family you have.
Oh, thank you so much. Good morning. I like that little
I don't know what pose this is that my daughter and I were doing, but
It's just what you do as a mom. You got to pose with your girl.
you do. You got to play along.
Absolutely. So glad to have you. And of course, here in the Adult C. Simons Jr. Family Broadcast Studio are two people from the Pediatric Cancer Survivorship Transition Clinic here at the University of Kansas Cancer Center. We have Dr. Becky Lowry, who helps lead the clinic as medical director. And across from me is Kyla Alsman. She is a registered nurse and a nurse navigator, helping patients during their very complicated, oftentimes, medical journeys. I've decided nurse navigators are kind of where it's at. They make the world go round here, don't they? And really they elevate that level of patient care. So we appreciate you. Thank you all for being here. Laura, this is not your first time meeting Kyla and Dr. Lowry. When you first met them, what do you remember about coming to the clinic and knowing that you may have found the right spot?
I just remember that I never felt rushed. Like, talking about your past health history and all of the things that you've gone through, this isn't just like something that's happening currently, it was in my past. So it was just, there was no like looking at your watch, you know, I got to go to my next room. It was so like, take me through everything. And that just really laid a wonderful groundwork for going forward in my health journey, and knowing that I had an ally and somebody who was always going to help me along this journey, because I will have to do so many things throughout my entire life. So I just felt like I met my match.
Met your match. Dr. Lowry, what are some unique healthcare needs that adult survivors of pediatric cancer have or might have?
Yeah, absolutely. And I want to say, I think it is such a privilege for Kyla, and I think I can speak for both of us, to have the opportunity to care for patients like Laura in this setting, because it's a joy and a privilege for us. So as Laura alluded to, there are a number of things that we think about patients needing to have monitored as they go forward into adulthood. We call those late effects, but those are health conditions that are unique to their prior treatments. It's such a great place that we're in, that the treatment that we have available for childhood cancers is really effective. It's a very successful much of the time, and that's fantastic. It means, though, that as patients continue to evolve into adulthood, that years and even decades later, there are things we need to think about. So an example might be thinking about heart-related conditions. I know we've talked about this on the program before, but things from prior radiation or certain types of chemotherapy can increase patients' risk for heart-related concerns. Certainly radiation, Laura did such a nice job of talking about high-risk breast cancer screening. So our patients who have had radiation to the field of the chest, for example, they will start their breast cancer screening at an earlier age and with different technology than patients that do not have that history. We also know that there are secondary cancers. So we've talked a little bit about in the past that there's always understandably worry and anxiety about a prior cancer returning. A lot of what we do is actually watching for other cancers or secondary cancers that might be at increased risk, like the breast cancer, or also like skin cancer or colon cancer, based on prior treatments. So really what we have the privilege of doing is helping patients understand their, what we call a treatment summary. So that succinct summary, and I have to say that Kyla does the really difficult work that is often making a stack this high of charts into something that is 1, 2, or 3 pages of succinct summarization of prior chemotherapies and prior radiations. And then we share that with patients, we share that with their care team, and we use that to guide them on the things, as Laura alluded to, that are unique or personalized to their care plan.
So Kyla, let's talk about that big stack. So is this, when a patient finds a transition clinic, are they bringing you? How does it work? Because I want to know what somebody might have had to do in the past before a transition clinic like this came along. Because I'm thinking, you're done with your pediatric care and you just almost have to start over and sit around and wait for new health problems to hit you. So where does that stack literally come from, and how do you sift through it.
Yeah, so once someone calls, I will call them and ask them several questions. Where was your treatment at? Did you get chemo? Did you get radiation? Did you have a bone marrow transplant? Once I find out what location they got, I then will request their medical records from that facility. And then there's specific important pieces that I know to ask for, like the chemotherapy, the radiation, any surgeries, things like that, so that I can then go through those records and put together a 2 to 4 page summary, which then tells us what we need to continue to monitor for. So that's a big part of making sure that Dr. Lowry doesn't have to spend hours going through medical records, and then she has the pieces that she needs to continue to recommend the screenings that they need.
Imagine like a lawyer walking into a courtroom with one of those roller things with just boxes stacked up. I mean, this is how long some of these pediatric patients have been going through their health problems. They've got probably boxes and stacks of all sorts of stuff to sift through.
Well, that's exactly right. And many of them were treated at a time before we had electronic medical records. So Kyla's often sorting through papers that are handwritten and filed
written up differently
and written
than
up
they are
differently.
now.
Yeah, there were different expectations about production of treatment summaries when many of these patients went through treatment.
All right,
So.
good necessary work across the table here.
That's right.
Laura, what kind of health issues for your childhood cancer or treatments that you received do you live with now?
So as you mentioned, I did have a hip replacement when I was 16, which is very weird. And when I tell people, they're like, wait, what? And I'm like, well, I'm 35 now. Imagine me telling you this when I was 16, that I have a total hip replacement. So I like to say that I'm like an 80-year-old in a 35-year-old's body. My body just is, I don't start out the day at like a full tank of gas. You know, I don't start out at 100%. So, you know, I suffer with just like chronic body aches and pains. That's why I say I feel like I'm 80 sometimes, because I just feel my body has been through so much traumatic treatment that, you know, it's not necessarily like a diagnosis or something I have to eat that I can treat. It's just, this is the cards I was dealt. And, you know, the life-saving treatment, I wouldn't change a thing. I think that going forward, you know, with science and technology the way it is now, hopefully we can come up with some more targeted treatments so that children in 20, 30 years don't have to still monitor, but not have to have that in the back of their head that like, I'm probably going to get a secondary cancer. I'm probably going to have this late-term side effect.
So how often do you see a doctor?
I get the privilege of seeing Dr. Lowry and Kyla 1 to 2 times a year in terms of like oncology care, and getting kind of the rundown and the plan for the year. And then I see other specialists and doctors all throughout the year. I always tell my husband, don't worry, we're going to meet our deductible, because I see a slew of doctors.
Right. So Laura, tell us about how Kyla has helped you personally.
I have reached out to Kyla on numerous occasions to ask questions about results from tests, and she's so great and so responsive and helpful. Most of the time it feels like I'm talking to just like a peer versus, you know, sometimes medical professionals can seem a little stuffy, no offense, everybody. But I feel like it's been so easy to reach out and ask these questions to them that sometimes people might be, you know, scared to ask. Or, you know, I had a breast biopsy that was abnormal, and they were both so helpful in that journey, being like, listen, this is probably going to happen again. We know this is, you know, really scary to have these abnormal results and have to wait, but, you know, basically cheering me on, like, you've got this, don't worry. I got a phone call from Dr. Lowry talking about, you know, that breast biopsy result, and she was very, like, you know, explained everything and was just really helped calm my nerves and ease, you know, all the worries in my head. So it just feels like I have a friend in my unfortunate cancer journey.
Yeah, it's like having a friend with a pickup truck. That's always great, or a friend who has a boat or a pool. You don't really. So now you have a friend who's a nurse, a friend who's a doctor, and you just pick up the phone and call them and ask them for help anytime. So it's great. I love that. So, Laura, take us. Just take us way back to the 8th grade. When did you first spot cancer? What was it like first getting diagnosed in middle school?
Yeah, it was, middle school's a tough age for any girl, I would say. And I actually was at home and my sister was rubbing my shoulders, which wasn't a normal occurrence. So I'm glad she did it that day. And she just was poking at my collarbone. And I was like, stop it. What are you doing? And she was like, you have a lump coming out of your collarbone. So I, of course, went in the mirror and was like, oh my gosh, I do. So my mom was like, it's okay, we'll call the pediatrician. And so I went the next day and they took x-rays and, said it could be some infectious drainage. So they sent me to the hospital to get a CAT scan just to make sure. And I remember being so traumatized because I was deathly afraid of needles. And I, had to get an IV for the contrast. And once that was over, I was just like, okay, we're done. Like, that's all I have to do. And I remember going home and my mom came in and was like, hey, we have to go to the hospital right now. We have to go to Children's Mercy. I was like, I just came from a hospital. So the rush on that was just because it was up against my my windpipe, and they were afraid I could stop breathing at any point. So it was a whirlwind after that of test scans, biopsies to try and figure out what it was.
Wow, that's a heck of a shoulder rub, and so glad it happened. I mean, that gave me chills thinking something that how long could that have sat there without it going noticed. Let's talk about mental health for a moment. So important that we touch on this because it really affects all of us, and certainly somebody who has gone through cancer. We know it can be different for everyone, but is there a survivor's guilt, a dread that the cancer could come back? What kind of mental health mental issues weigh on you, Laura? And how can we help other people going through maybe what you've gone through?
There's a lot of mental health issues that go along with it. You mentioned survivor's guilt. I've now been 20 years cancer-free, which is such a huge milestone, and I recognize that. But I also see people all around me being diagnosed with cancer, dying suddenly of cancer, and it just hits you like, why me? Why am I fine now? And why did this happen to someone else that I'm close with? So I think that's something that I will always struggle with. And even fertility, like I was for sure I wasn't going to be able to have kids. I was like, nope, I'm pretty much going to be infertile. And I was able to have my 2 children naturally, which was the greatest thing to happen. But I see people who have gone through treatments like I have adopted, done IVF. And so that also weighs on you. Like, why was I just able to get pregnant so easily? So it comes in a variety of forms. And it's something that, I struggle with. I tend to have annual pity parties for myself where I'll be like, why do I feel so old? And why is this my life? And then I realize, okay, you're fine. Everything is good. And these are just the cards I was dealt. So I do struggle with mental health issues, and I am passionate about making that known so that it's not such a stigma, and that, as an adult survivor of childhood cancer, that you're not alone, and there's people that have, these thoughts and these issues that they go through on a daily basis. So a goal of mine is to kind of get a group of all of us like-minded people together, childhood cancer survivors that are now adults, and just to make it feel like you are not alone, and these thoughts are going through other survivors' heads as well. So you don't feel like, you're on an island by yourself.
Mm-hmm. Well, thank you for sharing that. Dr. Lowry or Kyla, how do you address that with patients? What do you hear?
I think it's such a great question, and it's so important, and we're so grateful for patients like Laura who are willing to share their story, because I think just as she alluded to, when we all share, just as you said, Jess, that it's something that impacts all of us, that I think that normalizes it in a very healthy way for everyone, because it does impact all of us. Cancer is an emotionally complex journey, and we know that there are stages and phases, just as Laura alluded to, that patients are going to experience. So one of the things, I think I can speak for Kyla about this, that one of the greatest joys for us is when patients have been following with us for several years, and they will sometimes spontaneously say, do you remember how scared I used to be when I would come into clinic? And I feel so much better now. And so our hope is to really wrap around them a support team, so that patients like Laura know that if something arises that we need to handle, we're so fortunate to have great experts surrounding us that can help us handle that, and that we move to a place of helping them feel more empowered about having the tools around them to navigate the next steps. And we're really fortunate, and Kyla can speak to this as well, we're so fortunate to have an embedded psychologist. Dr. Carolyn Bates is embedded in our survivorship clinic, really newly as a resource in the last year or so. And so she connects with each of our patients to really talk about, hey, it's normal, just as Laura said, to have a lot of these complex feelings and emotions, and we want to help you walk through that, and we want to help you get any support connections that you might need.
I would agree with that. And I think with these patients, it's, when they're a child, they may be able to move through it, but then as they get older, they may have a lot of questions because they may not remember everything that they went through, and then start to realize, well, why did I have to go through this as a child? My childhood looks a little different. So there's different things that come up at different moments.
And you have the biggest job of all, because you got to also just be that really good friend. But you're probably pretty pleased to be able to do that.
Yeah, no, it's very rewarding to help walk them through different things and see them succeed in different parts of their life.
And I wrote down, Dr. Bates?
Dr. Carolyn Bates, yes, she's fantastic. She would be an excellent resource. And the one other thing that I would say, Jess, is that we sometimes talk about, Kyla and I, that, Laura alluded to the why did this happen to me? I think it's also really important to remember all of us have some journey with our health, with our family history, with our, maybe genetic profile, maybe past risk factors. And so as much as we can help patients understand this is true, this is a unique burden or strain related to your health care, but many of our patients, even if they don't carry a cancer diagnosis, have other unique strains and burdens with their health care. And so sometimes that can be helpful, just to normalize that it's hard to know those burdens when we're walking around in the community. We don't all have a list of the things that are part of our medical history or past, but many of the patients we see.
But I love people opening up and talking about it.
100%.
Saying it is okay. Anyone watching live right now can ask questions for Laura, Dr. Lowry, and Kyla, so make sure you get those questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. Let's get a quick check on our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Hi, good morning. Yeah, right now in the hospital we have 62 total COVID infections, but almost half of those are active. So 30 active infections, 4 in the ICU, still 2 on the ventilator. Again, I think we are hoping, as Dr. Stites said on Wednesday, that over the next few weeks we will see those numbers decline. We didn't really see that last year, but the previous year we did, and obviously we're trying to get to 0 cases in the hospital.
Concerning headline from the CDC I want to ask you about. They're warning about a rise in, quote, almost untreatable Shigella infections. Leave it to your segment for a word I'd never heard of before. So this is a bacteria that spreads through feces. It can cause severe diarrhea. Shigella itself isn't new, but this drug-resistant type of Shigella is. What do you make of that?
Yeah, absolutely. So a very quick breakdown. So Shigella is a bacteria different from SARS-CoV-2, which is a virus. It is spread through that fecal-oral route. So most people are going to be ingesting this bacteria. It takes very few organisms to cause disease. When you do, you get a serious gastrointestinal disease. It has been fairly easy to treat, but what they are seeing now is an increase or a rise in those isolates that are resistant to those more common antibiotics. There still are a few antibiotics that we are able to use, but they require, most of them require hospitalization to be able to use those. And the number of antibiotics that we are able to use is certainly decreased. So that poses a problem, but this is a more global problem that we have heard about with drug-resistant bacteria, whether it's drug-resistant gonorrhea, more extensively drug-resistant tuberculosis, and of course Shigella here. So we are just seeing that on the rise globally, not for just this population of bacteria, but many other infections as well.
All right, thank you for explaining that, Doc Hawk. Thanks so much. Any reporters on the line today? Let's get to community questions because we've got a few here. Lexi wants to know, how often does cancer come back? I mean, I know that's a very vague question because I would imagine it's the type of cancers. What can you tell us about that?
Yeah, that's such a good question, and it's one that we get often because it's anxiety provoking for patients. It really is very personalized to each individual's journey, and remembering, as we were talking about just a moment ago, that your risks for cancer are not just related to your prior cancer. There are environmental factors like, are you a smoker or are you not? There are health factors like, have you had the HPV vaccination or not, which we know is one of the vaccines that can help prevent cancer. But cancers come back in terms of the primary returning less and less as you get farther out from treatment. So we do often think about 5 years as kind of a really important milestone. I think Laura shared in her original experience the celebration that happened when she was at the 5-year mark, and that is something that is important, and it's a timeline distinction we think about because the risk of return drops so dramatically after that time.
Kyla, I'll let you answer this one. Becky wants to know, do people age out of the adult survivorship transition clinic, or can they stay there for life?
They can stay there for life. We kind of think of, as you age, we all have increased risk for different things. These patients have a little bit of accelerated risk, so meaning that they could develop, like if they were to develop breast cancer, that could happen earlier, which is why we start screening earlier. Same with colon cancer. We start colon cancer screening earlier if you've had radiation in those zones. So it is something that we'll continue to monitor lifelong, and they can come and see us once a year and then continue to see their primary care provider.
That was my question. Is this just an extra layer, meaning these survivors are still going and doing all their screenings, seeing their...
A lot of primary care providers will say that they're not comfortable with the survivorship, so we like to partner with them. We still want them to continue to have that relationship with their primary, and then we will send the treatment summary, our recommendations back to their primary, and then make sure that they're getting the screenings that are pertinent because of their history, and we'll do those every year.
Laura, I'm going to leave this last question for you. It's from Tina. She says, is it possible to, quote, put cancer behind you or move on from cancer? Kind of, what do you do with it?
That's an interesting question. I don't think you can ever put it to the side and move on. I think it's always in the back of my head, or sometimes, as my sisters like to say, I pull the cancer card, which it's always in my back pocket and I can always pull it. I think that it's always with you, and I think that's a good and a bad thing. So I think it helps, like I mentioned, it helps me stay positive because I know what I've been through and I know how far I've come. So I think that it's, am I glad that I got cancer? No, but I think that it's made me who I am today. And yeah, I think it's something that I carry with me and think about a lot of the time. So I don't think it ever leaves you. The journey is going to be with you forever, especially if you're proactive in your health journey. You have to stay on top of it and always be getting the recommended tests and scans. So it's never like out of sight, out of mind, for me at least.
Absolutely love this conversation today. Just really important, and love knowing that a resource like yours is here and patients and survivors like Laura are using these services. Laura, last question is for you from me. Tell me about the spoons behind you.
So, okay, this is in my dining room. These, this way. These are my painted spoons. I got this weird idea, and I was like, I want to paint spoons from a thrift store and then glue them on the wall. So I told my husband, he was like, okay, go for it. So I hot glued a bunch of painted spoons to my wall, and I think it's really cute and fun, and it's a great conversation starter. So, that's one of my creative outlets, is doing weird, random things like that.
Well, I love it. It's so artistic. I've been looking to steal people's ideas because I'm doing some decorating at home too, and I was like, I like your idea. Of course, I'll try doing it, and it'll be one of those Pinterest, like, this is what it looks like online, and this is what it looks like when someone tries to recreate it. I'm sure mine will look awful, but thank you for the wonderful, beautiful, artistic idea today.
Of course.
It looks great. I love that you're using art to kind of, express yourself and move through. So thank you. I want to get final thoughts. And Kyla, let's start with you.
Well, I will just say that I think it's important to continue your screening, and I feel so privileged to be a part of individuals like Laura's journey. I used to work at Children's Mercy as a HEMOC nurse, so being able to see some of those patients that are now over here having babies and getting married, it's just exciting to see that for these people who have been through something so significant in their life.
Yeah, big full circle moments.
Yeah.
Dr. Lowry, final thoughts.
I think that's perfectly said. Really, it's just, as you can tell in the brief time you've had the opportunity to be with Laura, it's such a joy to be a part of her journey and her experience, and it's a privilege for us. We really hope to offer personalized support that's unique to every patient's journey individually, and hope to get to a place for them where they feel empowered and we can unburden a little bit of the worry related to healthcare and let them just enjoy life, enjoy those kiddos.
I like that. Okay, I'm going to let you have your final thoughts. Laura, please.
I would just say that I'm just very thankful for this transition clinic. I think that going from Children's Mercy, like I said, where it was such a wonderful experience as a kid, and then it was like you're on your own. This is just setting the cancer survivors that are, going through treatment now. It's just going to set them up for more success, and I think that is exactly what we need, and I'm really glad that we have this in Kansas City. That's something I'm always so thankful for, is that we have such a remarkable hospital and providers here in Kansas City, and I just think we're super lucky to have that. And I'm just really thankful for the care team that I have and the attention that they give to every one of their patients. It's really helpful for us going through this journey and not feeling like we're alone. So thank you.
You are not alone. You have friends sitting right here at this table, and we appreciate you so much. And thank you so much for sharing your story. Glue whatever you want to your wall. Enjoy your children. Live your life, and we will see you very soon.
That is right. Thank you.
Love it. Love it. Thank you so much. Dr. Hawkinson, final thoughts.
Yeah, we heard about, those things that go on inside our body that we really don't have a lot of control of. This week we heard about norovirus infection and now Shigella infection. We do have a little bit of control over those things that continually to assault us. The most simple thing, but the easiest and the best thing to do is to continue to wash your hands frequently, practice good hand hygiene, soap and water. That will help provide a lot of protection from these other things that we're dealing with on a routine basis.
You've taught me over the last several years to wash my hands.
Easy.
I've got it down pat.
It helps a lot.
It does. Okay. Doc Hawk, thanks. And thanks to all of our guests today for being here and all of our viewers for watching. It is Thursday, so of course that means a new episode of All Things Heart coming up at 10 a.m. Alexis Del-Cid joins us with a preview. Hey, girl, how are you?
Good morning, Jess. I'm so excited for this episode. It's super interesting. They always say the eyes are the window to the soul. We've all heard that expression. But your eyes could also be the window to your heart, quite literally, your heart. We're going to tell you about a man who went in for a quick eye checkup at the University of Kansas Health System at the eye clinic. He was experiencing something that a lot of us get.
I had little fuzzies or floaters. I don't know if there's a medical name for it, but everybody gets them.
I've gotten them, called floaters in our eyes. You blink a little bit, they go away, you don't think anything of it. But when Pat's ophthalmologist here looked into his eyes, he saw something deadly brewing. He sent him straight to the ER. That was a move that saved Pat's life. So we're going to tell you exactly and show you what the eye doctor saw, what it had to do with Pat's heart, and what you need to look out for. This is a fascinating episode of All Things Heart. That's coming up at 10 a.m., so I hope to see you then.
Well, you'll see me, and I remember we sit next to each other, and you asked me one time, you're like, do you ever get floaters in your eye? And I was like, I don't know what you're talking. I said, I don't know what you're talking about. So I'm interested to hear more about this.
You either totally know what they are, and you're like, yeah, floaters, and none of us know the medical term for them, or you're like, what are floaters? So if you get them, or you know someone who's talked about them, this is a cool episode, or anyone who goes to the eye doctor. It can save your life.
All right, Alexis, thanks so much. We will be watching. Again, thanks to our viewers for being with us today. Have a great one. We'll see you back here tomorrow at 8.
Coming up tomorrow on the Morning Medical Update. Searing leg pain can get ugly. For one man, simply standing up was agony. I'm Jessica Lovell, coming up on the next Morning Medical Update. Learn what caused that pain and the treatment that got him up and active for the first time in years. That's Friday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.